What was the inspiration? I might feel like I'm switching gears really quick, but I you have so much to teach. And what was the inspiration for the Harder Not Smarter Not Harder podcast? Was that because you had so much to teach and it wasn't enough to do it at one person at a time, or how did that come about?
So the Smarter Not Harder podcast, it came out of our nonprofit organization, Health Optimization Medicine and Practice, or Home Hope for short. What we really wanted to do was educate. And we knew that the best way to educate was to bring on people that had a lot of education that they could provide. I mean, personally, of course, I'm on podcasts all the time and doing education for a lot of different things that I do and that we do. But we decided, because there's really four main people at the organization. There's myself, there's Dr. Ted Atracoso, Boomer Anderson, who's the CEO of both Home Hope and our for-profit Transcriptions, and a lady named Jody Duvall. She's a naturopath down in Australia. And so we wanted to create what's called a podcast network, where we would have roving or alternating hosts. So we'd have, sometimes it'd be Jody, sometimes it'd be me. Over the years, it's become a lot of me, and everybody else kind of fills in, because I think I have the most fun with it, honestly, because I get to bring on clinicians or practitioners that I work with oftentimes, or that I don't know enough about. Like, for example, I had a guy on named Bryce Applebaum a couple months ago, and Bryce is this vision therapist, optometrist down in DC. And I was like, I just didn't know the stuff that he was doing. And I just got so interested in the work of retraining the brain using vision, and all these various aspects of it. Or Brian McKenzie, who I was mentioning earlier, who's not a doctor, but he's got an amazing framework on how to think about breath. And so the podcast really came about as a way to bring more attention to the nonprofit, no doubt about it, because we're looking to create more practitioners that want to learn how to optimize health and focus on the first standard of care for health that we've been creating. So everybody knows there's a standard of care for disease, every
Mm.
disease that you can imagine, but there's no standard of care for health. So could we do that by bringing more awareness, having the podcast, and bringing on guests that were aligned with our mission? And sometimes we have amazing Nobel laureate scientists on there. Sometimes we have people that are doing breath work. I just interviewed somebody today that specializes in GLP-1s. It's a very interesting topic, and obviously a hot topic for everybody. And she tried to convince me that everybody needs to be on them. That's okay, right? That's a really interesting argument. And we discussed why. And so we're always trying to bring on people that bring in different perspectives. But what we always try to do on the podcast is bring it back to what we would call first principles, which is a foundational approach. How are you optimizing the self? Like, how are you optimizing the body, the vitamins, the minerals, the nutrients, the cofactors? How well are mitochondria working? It's like, if you're giving GLP-1s, for example, but you're not really doing some of that other stuff, like, are you going to see the benefit overall if you're not really truly supporting the system? The answer is no, right? And so we talked about on that podcast, GLP-1s are great, but if you're just having McDonald's every day and taking GLP-1s, that's
Right.
going to do nothing for you. And in fact, it's probably going to be worse for you, because you're never going to be able to come off the drug. And if you ever do, you're going to get so much more weight back on you than you did before. And so the podcast really is that. It's kind of it's a container for us to talk about our nonprofit, bring people in there that are practitioners, that either licensed or not licensed, that are interested in working with clients, but having a different perspective entirely. And then I get to have a lot of fun speaking to friends and colleagues, and that's been a lot of fun over the years.